Hello everyone, thank you for coming to this video. In this video, I would like to talk about one of analytical study designs in pharmacoepidemiology, which is the cohort studies. So this is the second video explaining the analytical study designs. This video is for a series of lecture for public health pharmacy with pharmacoepidemiology course, Department of Pharmacy, School of Healthcare Professions of University of San Carlos, Philippines. So what is the cohort studies? So we take the term cohort from the term that is used for a group of Roman soldiers. So this characteristic of soldiers, they always go ahead. So we can use this to remember that the cohort study designs is most likely to be prospective. So prospective. So this is to understand the study design is to understand many outcomes from a single exposure. So we will depart from a single exposure. So we have two groups, the case groups, so that's the exposure groups, and we have the control groups that contains those who do not have exposure, those that without exposure. So and from this we will try to find as many outcomes as we could to establish the association between the exposure and the outcomes. Because this cohort studies is prospective, so as part one criterion for causal relationship requirements can be fulfilled. That's the temporal relationship. So this is this study. The study design is can be said as stronger to provide evidence rather than the case control studies. The number of participants in the control group can be equal or larger than in case group. So this is similar to case control study. The number of participants in the control group should always be equal or larger, than the participants in the case group or the exposure group in this case of control study. So diagrammatically, the arrow here represents time, and the researcher is the know at the present time. The researcher is with the exposure as well as without the exposure, and then we will observe the outcome. Some cohort studies can be longitudinal, so it means that the study will observe the outcomes after tens of years, so it's very long. So this is what we call as the longitudinal studies. So the outcome of interest, there could be more than one outcome, should be free from when the study begins. Should be free from the participants when the study begins. So the common output from this measure, from this design, is relative risk, or we can call as a risk ratio. So the risk ratio is to compare a risk of a health event, can be disease, injury, risk factor, or death, between a group with risk case and a group without the risk control. So this is calculated using by creating a ratio between the risk in the case group and the risk in the control group. So if we represent it in the table, we can have this table. So the row is the presence of an exposure, the case group, and the control group. There is no presence of exposure. and then these the columns are the outcomes. We have A, B, C, D here, and then we have A plus B as the total number of exposure in all cases, in all member of cases, and then the number of total in the control groups. The risk of an outcome in exposed group, so we observe the disease, injury or death in, that is represented by A divided by A plus B, the total. And the risk of an outcome in the control group is C divided by C plus D. So when we create the ratio between these, we found the risk ratio. So as for the interpretation, if we have a value of 1, then the risk is identical between two groups. So it means that those who are exposed to the exposure develop the outcome just similar as those who are in the control group or those who are unexposed. If the relative risk is more than 1, then the risk for developing an outcome increases, or larger in the case group rather than the control group. That's also for if the relative risk less than 1, then the risk decreases in the risk for developing an outcome decreases in the case group. So let's take for an example. So this is the design, the complete design. So from the population, we select the members for the case group and control group, and they must be free from our outcome of interest, and then we observe whether the member of case group develop disease or injury or death, or not developing a disease, injury or death. So we observe the similar outcomes from the for the control group. So let's take for example from the vaccination. So we try to observe the adverse effects from vaccination. Let's take COVID-19 for an example. So when we have numbers here, then we can calculate the relative risk. So just because in the slides I do not calculate the relative risk, just try to calculate the relative risk by yourself. So the advantages from cohort studies is that we can have a temporal relationship, because the cause must present before the outcome. So we know the exposure as the cause, and then the outcome we can observe later. And then this is also minimum to selection bias, because we can really show that the member of the case group are those who are really exposed to a medication or kind of treatment, and those who in the control group are not exposed, so unexposed to the similar exposure. The disadvantages, they usually needs this study design usually needs a large number of subjects, and probably they need a long observation period because some kind of outcomes, for example death, we need to observe it in the long period of time. And this is vulnerable to bias if a high number of participants are lost during the follow-up, or we can say it as a dropout rate. So yeah, as part of kind of ethical requirements, we have to respect for autonomy for the participants. So it really depends on them to continue to participate in the study or not. If they have the right to choose to stop participating from the study. I don't know, probably at any time of the study, but usually there are some kind of contracts that the participants need to sign. So, but yeah, ethically, we have to respect the autonomy of the participants. So we have, if they do not want to participate, then that's okay. But it means that we have what is dropout participants. So this is an example of a longitudinal study using a bird cohort, observing about the intake of vitamin D and the rise of type 1 diabetes. So the observations is among the pregnant women. So among the pregnant women, so we observe the babies from these pregnant women, and the observations from 1966 to the end of December 1997. So it's really a longitudinal study because it takes more than 3 decades to understand the effect of vitamin D intake and the risk of type 1 diabetes. But unfortunately, I think I do not include the results. So please find this article by yourself and try to read it to understand more about the cohort study. This is DOI if you want to get the article. So thank you for listening, and I will continue to the next video that will be talking about the randomized clinical trial, or we can call this randomized control trial. Okay, thank you so much.